In this video, I'm going to show you some tips to try to reduce your symptoms of plantar fasciitis. Now, when we're talking about the plantar fascia, the bottom of the foot, what happens is this area becomes inflamed, irritated. A lot of times we take a passive approach with this, and so we just perform stretches, or maybe we're taking anti-inflammatories, or you could be rolling that frozen water ball on the bottom of the foot back and forth, and just you're not getting the relief that you need. And a lot of times that's because there wasn't adequate loading done to the tissue. We need to go through some exercises in combination with stretches, and then also exercise some other parts of the body that have been shown to have an effect on the plantar fascia or that bottom side of the foot. Our first technique I call gas pedals, and so what you're going to do is you're going to take one of these resistance bands. You can use a towel or a sheet or whatever you have if you don't have any resistance bands. You're going to take this, put it around the ball of the foot there, just around the base of the toes, and you're going to pull back and you're going to push down just like you're pushing a gas pedal in a vehicle, and you're going to push down. You're going to work on initially just trying to go through the movement, and then I would like for you to be able to hold that for about 10 seconds each time that you push down. So you push down, I'm going to try to hold it about 10 seconds and then come back and relax. I'd repeat that for 3 to 4 sets of 10 to 20 repetitions, and that's something I would do several times a day. The next thing we're going to do is going to be kind of an active assisted stretch. You're going to take that same strap, or if you need a stiffer strap or something that's not going to have any give where you can really pull, use that. Put that in the same location. You're going to pull that back. Now as I pull this back, I'm feeling that stretch in my calf muscle here. I'm feeling my hamstring. So what you want to do is, while you're pulling back, activate your tib anterior, this shin muscle. If you'll notice when you pull your foot back, this muscle kind of on the top outside here of your lower leg is going to kind of pop out. So you want to feel that muscle pop out. So not only are you stretching the muscles in the back, you're activating this muscle here, this tib anterior muscle. When you do that, because of what's called reciprocal inhibition, it's going to force the calf muscle and all to relax a little bit, because that is the antagonist. It performs the opposite action of the gastrocnemius and the soleus, or the calf muscle complex back here. So you're going to activate this, pull that back, and hold that stretch. I usually have my patients hold that for anywhere from 15 to 30 seconds. If you can keep this muscle contracted, if this needs to rest, if you can't keep this tightened up the whole time, that's fine, but just keep holding the stretch. A lot of people do perform that stretch where they stretch the back of the foot, and I think for me the part that a lot of people miss is not activating the tib anterior. That seems to work well for me. I suffer with plantar fasciitis myself, and that was a great technique that I used every day to resolve my issues. Next, we're going to work on hip extensions. Now, you may ask, why are we working on hip extensions when this is the bottom of my foot that's having the issues? Well, there is some research that supports that glute muscles being weak or not firing like they should could have an effect on the gait cycle, and that can kind of transfer some unnecessary force to the bottom of the feet. So what I have my patients do is, you stand here, you've got a strap or a resistance band fastened around the lower leg just above the foot. It's fastened over here to another surface or an anchor, whatever you have, and I'm going to work on just kicking back. So I'm just going to kind of kick back, tighten up my glute muscle here. I can feel this in the back of my leg here. And I'm just going to pull that back, and I repeat that for 2 to 3 sets, 10 to 15 repetitions, and I do that for a couple times a day. The next exercise we're going to do is we're going to work the tib anterior muscle. Remember, that's that muscle on the outside front of my lower leg here. So what you're going to do is you're going to take a resistance band, a small band, or that initial band that you were using for your other exercises, put it across the top of the foot, and I'm working on pulling my foot back. And so this is the opposite of trying to push my foot down, like going up on your toes. I'm just working on pulling that back. I feel that on this outside here. I'm going to pull that back. If you can't get your foot in that position, if you have someone that can hold this for you, or if you can fasten one in under the bottom of maybe a leg of a heavy chair or something and work on pulling your foot back, that works really well. Just complete 2 to 3 sets, 10 to 15 repetitions a couple times a day. For our last technique, you're going to take a tennis ball. If you watch my videos, you know that I like tennis balls for a lot of musculoskeletal conditions. So you're just going to take a tennis ball, you're going to put it under the bottom of your foot, and you're going to work on rolling your foot on top of the tennis ball, just rolling all around, all directions. You can hold that pressure, kind of press down. It's one of those kind of hurts so good kind of things. You just press down in that, roll that around, move that on the bottom of the foot, and maybe you do that for somewhere between 3 to 5 minutes, a few times a day. Thank you so much for watching. I hope this video helps to improve your pain, strength, range of motion, and functional use of your lower extremity. Thanks so much.